New at 6 tonight, a new bacteria has infected patients in at least 17 hospitals throughout the state. And tonight, it has some local hospitals taking precautions. NBC 26's Casey Hott is live at 6 with more.
Good evening, Stacy. The Centers for Disease Control and Prevention is calling it a nightmare bacteria. And while it hasn't been reported in northeast Wisconsin, hospitals have a plan in place if it is. It's called CRE, and reports show up to half of patients who were infected with this nightmare bacteria die.
As bacteria becomes more resistant to the antibiotics we have, that's where they become more dangerous.
Infection preventionist Carol Bess says Bellin Hospital has been closely monitoring public health alerts tracking the bacteria in our state.
They've been very much up on what's going on with this bacteria and wanting to watch what happens in the state of Wisconsin.
So far, 25 people in Wisconsin have been infected.
Well, it's scary.
Wanda Borshi is visiting a friend at Bellin Hospital. She says she's been carrying Lysol wipes after hearing about the superbug.
You're afraid to even touch a doorknob. You might get something that way.
So far, the bacteria has not shown up at Bellin, but if it does, doctors have a plan.
We would put them in what we call contact precautions. So caregivers coming into the room caring for a patient that has an infection with this bacteria, we'd put on a gown and gloves to help prevent the spread to other patients.
Physicians at Bellin say the risk of getting this bacteria is highest for people getting complex or long-term care in hospitals or in nursing homes. The best way to prevent it? Washing your hands. Casey Hott, NBC 26.